Hi guys, it's Susie. I'm coming to you late this Monday night, and sorry if I'm waking people up by the dings on their phone. Turn your notifications off. You don't need work when you're home. But anyway, wanted to come to you tonight with a bear brief and just give you some important updates. If you don't have time to read all of this bear brief at one time, please go back to it. There's critical information in it that I want to make sure that you have as soon as possible. So please go back and read everything. We are also ramping up the digital communication boards. I know everybody cannot eat lunch in there to do the social distancing, which is so important to make sure we don't have an outbreak here at the center. But be sure that you're taking time between those long breaks in those cases or just throughout the day to stop in and check just to see what's on the digital communication board as we're ramping those back up. Wanted to come tonight specifically to address a couple things about COVID patients. There's more information below about the COVID positive patients and what the criteria is for patients to come back. But I know that there was a lot of scuttlebutt last week when the COVID positive patient came back in. Wanted to apologize first for not getting communication out before that came back in. It had just been approved to the board, and we weren't communicating that to the medical staff until the general medical staff meeting on November the 18th. So I was not anticipating a patient as quickly as we had one, so I do apologize for that. When we had the last COVID positive patient that came in after a COVID positive test, we didn't have the protocol in place. It had not been through QM. The board had just decided what they wanted QM to consider. So we treated them overly cautiously with using the room in Bay 8 and pre-op for pre-op and PACU, but it was, to be quite honest with you, absolute overkill. But we were doing it because the process had not been vetted through QM and the board. I would like to think by now that you know that safety is priority number one for me. And throughout this whole COVID process, I've tried to make sure that safety is paramount, and safety of our staff, safety of the surgeons, but most importantly, safety of our patients, but safety of our reputation as well. I am never going to do something that actually is going to put the facility, you, our patients, our surgeons at risk. And I would like to think that you would know that by now from the track record that I've had throughout this whole COVID. Everything that we do is evidence-based. Everything we do is CDC guidelines. There's never going to be a deviation from that. This is no different. The patients that are post-positive, I have included information that actually shows if you're COVID positive, when can you be around other people? If you're COVID positive as a healthcare worker, when can you come back to work and what are the criteria? We've included those criteria on there for you as well. Every COVID positive patient gets reviewed by anesthesia. They will make sure that the two criteria that I put down for you is on there, but also if someone is really immunocompromised, they're going to extend it even further. But as you'll see on those COVID positive information from CDC, it's literally 10 days from the test if you're asymptomatic. It is 10 days from the resolution of symptoms or the improvement of symptoms if you actually had symptoms. We are going far beyond that. We're doing 4 weeks from a COVID positive test for asymptomatic, and we're doing 4 weeks from the resolution of symptoms if you had symptoms. That follows our guidelines for pneumonia or bronchitis as well, and we're going to take the conservative approach even for the patients. We know this is a thrombosis virus. We know this is a virus that actually causes lung breathing problems. We're messing with airways. So we're going to do everything we can to make sure those patients are going to be healthy when they have surgery as well, and not make a negative outcome for them for an elective surgery that they didn't necessarily need to have right now. We are going far above and beyond every hospital in town, every surgery center in town, as far as the precautions we're taking with eye protection, with N95s, with air exchanges, with extubating in OR still. Most people have scrapped that months and months ago, and they're still not seeing any outbreaks anywhere. There are surgery centers and hospitals across the nation that don't have access to testing for pre-testing their elective patients, so they're not testing anyone. That includes ENT surgeries. They're not testing anyone. They're not wearing N95s in the OR. They're only wearing masks for all of their staff, surgical masks. And they're also not doing air exchanges, and they're not seeing outbreaks. The only outbreaks that are coming from break rooms and lounges where staff have been exposed when they've been socializing outside and they've brought it into the facility and they've been asymptomatic and spread it before they had symptoms, or they didn't get symptoms at all and they spread it to multiple people. So we're doing everything we can to keep you guys safe. Sometimes I'm sure you hate it. Sometimes you probably don't like the PPEs we can get. whether it's the surgical masks we all hate, or the respirators, or whatever it is, the crazy surgical caps that look like garters. We're in a pandemic. We can only get what we can get, but more importantly, we are putting your safety over absolutely anything else. And that is going to be our decision-making process in the future, and it has been in the past, and it is right today. So anyway, hopefully you can rest assured in that information. The other thing that I wanted to just hit on really quickly, because I'm starting to hear questions and comments and seeing texts from people, and I'm sorry, I've got something in my eye and it's driving me bonkers. But is elective surgeries being shut down. People are starting to see that other places in the country where there's outbreaks, hospital systems doing that. I wanted to tell you my honest take on it and where I think we'll end up. I really don't think the surgery center itself will be shut down unless we don't have enough staff to operate, or we don't have enough surgeons to operate. I see it's a self-policing thing. I don't think the government's going to shut it down. And pretty much the governor said that very thing today here in Ohio right now. The hospital systems are probably going to be much more likely to be able to actually shut down elective surgery, because they need to reallocate staff, or they need to free up hospital beds and hospital space much before we would ever be considering it. But I can't imagine, as long as we take precautions and we all stay healthy, the only thing that I could see that would be limiting anything is patients deciding in the middle of a COVID outbreak that they don't want to have surgery. But it's not going to be all patients. It's just going to be a decreased volume than what we're used to, which is what we've been seeing all year. So hope that brings you a little bit of peace. It's Susie Walton's prediction for the future, so take it for what it's worth and with a grain of salt. But everything I'm hearing from our national association, from our state association, is there's nothing looming or coming down the pike right now. There's no bans. The state association and the national association did an amazing job of collecting data since we've been doing urgent cases and opened back up as an industry, to show that there has been no outbreaks where patients got COVID from being at a surgery center, for where staff got COVID from patients, that kind of thing in the ASC setting. They've also showed all of the delayed care and what the harm happened with patients from delaying elective surgeries that are still somewhat urgent, but didn't meet the actual criteria that was put out for us from the governor. So hopefully we won't be seeing that again, but thought I would answer that one as well. The other opportunity that I wanted to discuss on the COVID front was just the patient that ended up being positive within 2 days after being here at the surgery center. I heard some rumblings about people saying we would have been exposed. Why weren't we told? The people that actually had exposure that was probably more higher risk would be PACU phase 1. That's who's probably going to be notified. Even though we're extubating in the OR, the patients come to phase 1 PACU, they don't have their mask on and they're coughing. That would be the highest exposure of anybody in our building. Everybody else, if you're wearing your PPE the way you're supposed to, your eye protection, your N95s in the OR, you have no risk. In pre-op, if the patient's wearing their mask and you're wearing your mask, it doesn't count as exposure from CDC. So you have no risk. And that's been proven study-wide over the United States, of seeing no conversions happening from any of that. Even on COVID positive units. I mean, people are treating COVID positive patients, and a lot of times they didn't have the proper equipment, and even a surgical mask was enough to actually, and eye protection was enough to actually stop it if the patient was wearing a mask as well. So anyway, if you work in phase 1 PACU, you might be hearing from us. More information is coming about FIT testing as we're getting ready to do our own COVID testing here at the surgery center. We have no idea when that test is coming, but you're going to start seeing construction happening in our toy room to turn that into a little bit of a lab. Please don't panic. There are people doing this all over town. Jen and I and Nancy took a road trip over to Ken's Center, who's been doing it for 3 months. And we've been watching other people's process. We're going to have this ironed out before we get testing. More information will come as we have it. Please don't start stressing and worrying about things we don't need to worry about. No pre-suffering. So anyway, hope you guys are having a good evening and got more rest than I did tonight. And I will see you tomorrow. Take care. Bye.